Hello, and welcome to the Pre-Induction Education Session, or PIES, for Suboxone. My name is Sarah, and I'm a counselor with Addiction Services of Thames Valley, and today we are going to be discussing the addiction medication therapy known as Suboxone. This is our agenda for today. We will begin with Suboxone education, and then we will discuss the RAM Clinic, which is a program at Addiction Services that offers Suboxone. What is addiction medication therapy? Medication interventions for the treatment of substance use disorder. This is a harm reduction approach to recovery, helps to reduce the negative effects of withdrawal and cravings without producing euphoria, and is best used in conjunction with counseling. Suboxone is a medically recognized treatment prescribed by a primary care provider to those with opioid use disorder. Research shows that Suboxone, combined with counseling and other social or community supports, is an effective treatment for opioid use disorder. Suboxone may also be referred to as opioid substitution therapy or treatment, OST, or opioid addiction or agonist treatment, OAT. These two pictures are visuals for a full agonist, such as methadone, fentanyl, or heroin. A full agonist will fully activate the opioid receptor, which can lead to euphoria and increase in overdose. In the first picture on the left, the opioid receptor is empty. As someone becomes tolerant to opioids, they become less sensitive and require more opioids to produce the same effect. Whenever there is an insufficient amount of opioid receptors activated, the patient feels discomfort. This happens in withdrawal. The picture on the right, opioid receptor filled with a full agonist. The strong opioid effect of heroin and painkillers can cause euphoria and stop the withdrawal for a period of time, approximately 4 to 24 hours. The brain begins to crave opioids, sometimes to the point of an uncontrollable compulsion, addiction, and the cycle repeats and escalates. These next two pictures are visuals for a partial opioid agonist, which is Suboxone, what it does in our brain, and how it helps with opioid use disorder and pain management. Suboxone is the brand name for the medication, and it is made up of buprenorphine, a partial agonist, and naloxone, an antagonist. The picture on the left side, opioids replaced and blocked by buprenorphine. Buprenorphine competes with the full agonist opioids for the receptor. Since buprenorphine has a higher affinity, meaning a stronger binding ability, it expels existing opioids and blocks others from attaching. As a partial agonist, the buprenorphine has a limited opioid effect, enough to stop withdrawal, but not enough to cause intense euphoria. The picture on the right, over time, 24 to 72 hours, buprenorphine dissipates, but still creates a limited opioid effect, enough to prevent withdrawal, and continues to block other opioids from attaching to the opioid receptors. Suboxone is a tablet that is dissolved under your tongue. You must avoid swallowing the medication. Allow the medication to dissolve for 5 to 10 minutes to receive the full effects. Suboxone is sublingual, meaning it is dissolved under your tongue. Do not swallow, chew, or move the tablet after it is placed under your tongue, as doing any of these makes the medication less effective. Suboxone is absorbed into the bloodstream through the veins under the tongue. If it is swallowed, it will not work properly. You'll want to allow the medication to dissolve for the full 5 to 10 minutes in order to achieve the full effects. These are some examples of what generic Suboxone tablets may look like. Some clients have told us the taste is unpleasant and can be chalky. Other clients have also reported they felt more nauseous or had an upset stomach with the generic brand. The generic brand is what is now covered through ODB. Sublocade and Probufene. Sublocade and Probufene are covered under the Ontario Drug Benefit, or ODB. Sublocade is injectable Suboxone that lasts up to 1 month, and Probufene is a Suboxone implant that lasts up to 6 months. Individuals must be stable on oral Suboxone for a minimum of 1 week prior to being eligible for Sublocade or Probufene. The RAM team will determine the best course of treatment for all interested individuals. RAM staff are available to answer questions regarding Sublocade and Probufene. Sublocade and Probufene are alternative forms of Suboxone for treating opioid use disorder. Sublocade is an injectable form of Suboxone that lasts up to 1 month, and Probufene is an implant version that lasts up to 6 months, both of which are now covered under ODB. Taking Suboxone will result in physical dependence. Sudden decreases or discontinuation of this medication will likely result in withdrawal. For example, sweating, restlessness, bone and or joint aches, runny nose and or tearing, GI upset, tremor, yawning, anxiety, and irritability. If you wish to stop taking Suboxone, the prescriber will work with you to taper off the medication safely. It is important to be mindful that taking Suboxone will result in a physical dependence. It is important to note the recommended length of treatment is minimum 1 year. However, everyone's recovery is different and length of treatment will vary based on your use of opioids. As well, some clients will remain on Suboxone long-term for pain management. Common side effects of Suboxone include nausea, constipation, and sedation. These are usually mild and improve over time. Speak to your healthcare team if you have concerns. There are no serious long-term effects. Our clients report the side effects will subside 1 to 2 weeks once you're stable on your dose. In addition, clients have reported the side effects are more mild compared to methadone, and they are able to stabilize on Suboxone quicker, have a clearer head, and less brain fog. We have also received anecdotal reports from clients that Suboxone can improve anxiety and depression. Suboxone is safe in pregnancy. If you become pregnant while on Suboxone, the prescriber may need to make changes to your treatment plan. Addiction Services of Thames Valley offers a program called Heart Space for women who are pregnant, parenting, and substance involved. Heart Space provides a harm reduction model to support women and their children aged 0 to 6 years old. The next few slides will discuss the Suboxone induction process at RAM Clinic. The last use of opioids and current withdrawal symptoms will guide your Suboxone induction process. This is important to avoid precipitated withdrawal. Precipitated withdrawal, or PW, is a rapid and intense onset of withdrawal symptoms. Suboxone has a higher binding strength at the opioid receptor, which means that it kicks off and replaces current opioids, causing withdrawal. To avoid this, discontinue use of short-acting opioids for 12 to 24 hours and long-acting opioids for at least 24 hours prior to your induction appointment. If you have moderate withdrawal symptoms, higher doses of Suboxone are used. You are given hourly doses at the pharmacy during clinic hours. We encourage new inductions to arrive at the beginning of clinic. If you are not in moderate withdrawal, then the microdosing method of induction is used. Microdosing involves administration of small doses of Suboxone. You may be instructed to continue to use opioids during the transition period. During this transition, you may or may not experience withdrawal symptoms. The prescriber will determine the dosing schedule and give you direction as to when to stop using opioids. Some other considerations with Suboxone. You have the right to voluntarily withdraw from the Suboxone treatment program at any time. It may be unsafe to drive a car or other motor vehicle or to operate machinery during the stabilization period after starting Suboxone and during dose adjustments. Testosterone for opioid use disorder. Low testosterone levels and erectile dysfunction have been associated with long-term opioid use, including Suboxone. Testing testosterone levels can be done, and client may be referred to family doctor for testosterone replacement or to Dr. Mayer. The dispensing fee for Suboxone varies based on your drug coverage. There may be a dispensing fee at the pharmacy, and if you do not have drug coverage, if you do have drug coverage, bring this information with you to the pharmacy. If you do not have a drug plan, you are responsible for payment. If you are on OW or ODSP, ODB will cover the cost of Suboxone. If you do not have coverage, the average cost for Suboxone is $9 to $40 per day. Typically, for the brand name of Suboxone, it is $3 for a 2 milligram tablet and $5 for an 8 milligram tablet. At the end of clinic, the prescriber will tell you which day to return to the clinic and will provide you with a prescription. If you miss more than 5 doses of Suboxone in a row, you will not receive your current dose and must return to clinic to be restarted on Suboxone. This is to help keep you safe, as your tolerance to the dose will change if you miss 5 doses in a row, and you will be required to restart on a smaller dose. The next several slides will go through specific program information for the Rapid Access Addiction Medicine Clinic. The RAM Clinic is a program of addiction services in partnership with Canadian Mental Health Association. The RAM Clinic operates out of the medical suite at ADSTV at 200 Queens Avenue, Suite 260. This is a picture of the front of the building and the main entrance. There is an elevator available. This is a photo of the main entrance once you enter our suite on the 2nd floor, and then you will be brought to our medical suite. The RAM Clinic offers community-based, low-barrier services for patients seeking treatment for substance use disorders. The RAM Clinic focuses on addiction medicine and offers both medication and psychosocial interventions to meet client goals. The hours for the London RAM Clinic are listed below, and our contact information is 519-673-3242, extension 281. What to expect at the London RAM Clinic. Number 1, weekly visits. All clients are required to attend RAM Clinic on a weekly basis. As you progress through the treatment program, meaning you are stable on your dose and your urine drug screen samples are negative for all other substances, the medical team will negotiate your clinic visits, and you may be eligible to attend bi-weekly or monthly. Wait times can vary each visit. Please bring something to keep yourself occupied. It may be helpful to block out the hours of RAM for the day that you attend. Number 2, urine drug screening. Urine drug screening is required at every clinic visit. We require a urine sample, as the medical team needs to ensure Suboxone will not interact or contraindicate any other substances you are using or medications you are taking. We will inform you of what we were sampling for and will tell you your test results. Number 3, daily visits to your pharmacy with potential for carry doses. All clients are required to attend their pharmacy of choice every day to have your Suboxone dose observed by the pharmacist. This is to ensure you are taking the medication properly. Suboxone is also a controlled substance, thus it needs to be closely monitored at the beginning of your treatment. All doses are observed at a pharmacy that works best for you that dispenses Suboxone. Similar to your clinic visits, as you progress through Suboxone treatment, you are eligible to earn carry doses, or carries, which are your take-home medications, allowing less visits to the pharmacy. Maximum carry doses allotted is 6 per week, as there will always be one day you need to have an observed dose at the pharmacy. With each week that urine screen is negative for other substances, you will receive your take-home doses or carries. Number 4, mandatory check-in with a counselor or nurse prior to meeting with the prescriber. All research states that Suboxone and counseling allows clients to be more successful with their treatment. Therefore, it is a requirement that you will meet with a nurse or counselor at each clinic visit prior to meeting with the prescriber. Number 5, Sublocade and/or Probufene, later stages of treatment. As you progress through treatment and are stable on your dose, you may be eligible for Sublocade, which is for folks who are 8 milligrams or higher stable on Suboxone and is a once-a-month injection, or Probufene, which is an implant that lasts 6 months for folks who are 8 milligrams or lower stable on Suboxone. These 2 medications are an option for you once you have been stable on Suboxone for a significant period of time and have had negative urine drug screens. These medications are covered by ODB. If you do not live in London and are interested in accessing Suboxone, there is a Strathroy clinic, the Gracie Medical Recovery Clinic. The hours are Tuesdays, 8:45 a.m. to 12:30 p.m. and 1 p.m. to 3:45 p.m. The contact information is 519-205-0637. If you live in St. Thomas, Clinic 217 at 475 Talbot Street can support you with Suboxone. The hours of 217 in St. Thomas are located on this slide, and the contact information is 519-631-9040. We are going to pause for a moment. Take a breath. I want you to reflect on the information that was just shared with you and consider if RAM Clinic and Suboxone is right for you. If you are not interested in this treatment at this time, I thank you for your attention and patience, and you are welcome to exit this video. If you are interested in Suboxone at RAM, please continue watching for next steps on how to be connected with the RAM Clinic. Please note, primary healthcare providers such as a family doctor or nurse practitioner may be able to prescribe you Suboxone if the RAM Clinic hours do not work with your schedule. There are also several other clinics in London that offer Suboxone. If you would prefer a list of clinics in order to determine what is best for you, please bring this to the attention of your primary counselor. Next steps, how to connect with the RAM Clinic. Call the RAM Clinic at 519-673-3242, extension 281 to arrange an appointment. Attend the scheduled appointment to complete the referral forms and a physical health assessment conducted by the RAM nurses. The referral forms typically take approximately 40 minutes to complete. The physical health assessments typically take approximately 20 minutes to complete. If you think that Suboxone is the right form of treatment for you, please complete these steps in order to get connected to the RAM clinic. I hope this video was helpful in answering any questions you may have regarding Suboxone. Thank you for your attention, patience, and time, and enjoy the rest of your day. Take good care.